Good evening, everyone, and a warm welcome to the 2154th day of the Uninterrupted Daily Webinar Series of the International Forum for Promoting Homeopathy. It is my immense pleasure to welcome all the esteemed participants, doctors, students, and well-wishers of homeopathy who have joined us today from different parts of the world. So, today we are privileged to have with us a distinguished physician, author, and innovator in the field of homeopathy, Dr. P NIDHEESH MD. Dr. Dinesh has been practicing as a physician since 2011 and has also served as a medical officer under the Ayush mission. He is the CEO of New Life Homeopathy Clinic, Thrissur. He is also the author of the books The Hidden Protocol, The Father, and Archetype Modulation Therapy. He is the founder of Archetype Modulation Therapy, a approach that reflects his continued efforts to explore structured and innovative perspectives in clinical practice. And today, Dr. Nidheesh will be speaking to us on the highly relevant and thought provoking topic, a structured approach to clinical reasoning in homeopathy. Clinical reasoning forms the foundation, as we all know, of every good physician's practice. It is a process through which we observe, analyze, interpret, and integrate clinical information to arrive at a logical understanding of the patient and the case. A structured approach can always help us move beyond confusion and develop clarity in clinical decision making. We are truly honored to have Dr. P. Nidesh with us today to share his knowledge, experience, and insights on this important subject. So, on behalf of the International Forum for Promoting Homeopathy and everyone present here, I extend you our warmest welcome. And without any further delay, I invite Dr. P. Nidesh to take over the session and enlighten us on a structured approach to clinical reasoning in homeopathy. And over to you, sir.
Thank you. Am I audible?
Yes, sir, you're audible.
Yeah. Thank you. First of all, thank you for giving this opportunity to speaking IFPH, and I'm well honored. So can I share my slides?
Sure, sir.
So can you please make me co-host? Yeah, thank
Yes,
you.
you are the co-host.
Yeah, right. It's just a bit.
Okay, sir, are you able?
Yeah, can you see my slides?
Yes, sir, we can see. We can
Okay,
see.
let me make it presentation. Okay, now you can see my, it's clear, right?
Yes, yes, sir. You can start your slideshow.
Today, the topic I have chosen is a different one. It is all about clinical reasoning. I'm not here to talk about the remedies or any disease condition today. Before starting my session, hello. Hello.
I'm sorry, sir. There was some sort of disturbance. Someone has unmuted accidentally. I've muted them. You can continue.
Yes.
Yeah.
Okay. So before I start my session, I would like to my gratitude to my father, my guru, who has taught me this way to see the cases. So I am here to just share the insights which I received from him and my short span of practice for last 15 years and the researches we have done in the patients. And here I'm before you to explain the clinical reasoning. So that's why I put my first slide as before we speak about the remedies. In almost all classes where we go, or whenever we see a homeopath, the first question in everyone's mind is, what remedy should I give to that patient? Whenever a patient enters the clinic, first question that will come to every homeopathy physician is that, what remedy should I give to the patient? So that is the point where I just want to make the distinction. Instead of thinking, which remedy should I select to the patient, we must be able to think what is problem with the patient or what is in the patient that is to be treated. So I want to shift the focus from remedial part to the patient part or the suffering part. So we are actually doctors and not prescribers. That's a point which I talk to my juniors always. We are doctors. Why? Because some patient may need remedies, some patient may need advice, some may need exercise. So our duty is not to give the remedy, our duty is to restore the patient to health. So sometimes it can be a remedy, sometimes it can be a advice, sometimes it can be diet or regimen, whatever it can be. Everything is a prescription. So I just want, before I start my session, I just want to clarify this part. So going to my next slide. The issue with homeopathy is that all homeopathic doctors is thorough about medicines, about materia medica and the knowledge. The problem arises in a common point, how we select the remedy. Say, in some cases, doctors have shown in many cases that one dose of anti-miasmatic remedies or a series of pathological prescriptions or a keynote prescription has given the results. So, especially the young generation doctors are very much confused right now which method to follow. So the problem is that whenever a patient comes to a junior doctors, he first thinks about should I go with an anti-miasmatic medicine? Should I go with a constitutional medicine? Should I go with the keynote prescription? Or should I go with the pathological prescription? This confusion or chaos is the key point which makes homeopathy always in the dispute. So in this class, I am here to share my viewpoint on standardization of homeopathy, which we were working for past 12 years since I am passed out, and a patent and a methodology, a tool which I have created, which helps us to understand this homeopathy far better. So, before every prescription, the first question that must come to our mind is, what does this patient truly need? Medicine is not the first prescription. He may need a reassurance. He may need a counseling. Sometimes he may need a psychotherapy. Sometimes he may need surgery. Sometimes he may need a pathological prescription. Sometimes the case may be palliation. Sometimes we have to prescribe the homeopathic medicine. So, what a patient needs, that is the question, and that is the point which I want to explain today. So, let's start. Whenever a patient is coming to our clinic, first we have to see what is the state of the patient. Only after assessing the state of the patient, we can further move towards the prescription or whatever thing we have to do. For that purpose, we have created something called a standardization of homeopathy. That is standardization in the thinking procedure, not the prescription. Because prescription varies from doctor to doctor based upon the way he thinks and the knowledge he has. But how to select a remedy for specific patients can be standardized. Why? Because the patients requires anti-miasmatic treatment. If he goes to any doctor throughout the world, he must get an anti-miasmatic treatment. That cannot be changed in homeopathy. A patient who needs a constitutional medicine or a simlimum must get simlimum wherever he goes. For that purpose, we have made the whole case into 6 different levels. So, 100% of the cases which comes to our clinic falls under these 6 levels, level 1 to level 6. To identify these 6 levels, we have incorporated a method called a case-taking tool. So whenever we take a case, like in the general format, from presenting complaint to mental generals, this case sheet automatically becomes a questionnaire and it scores, and based upon that scores, the marks are coming. Based upon the marks, these levels are fixed. So I will explain to you that things, everything, if it is needed in the coming sessions. So it has totally 36 marks from 6 to 36. So level one is 6 to 10. If the case score is about 6 to 10, it comes under level 1. If it comes from 11 to 15, it comes for level 2. And from level score 16 to 20, it comes under level 3. From 21 to 25, it comes under level 4. From 26 to 30, it comes under level 5. And 31 to 36 comes under level 6. So here, what we want to tell you is that if the patient is coming under level 1, even the symptom similarity is the only thing we have to see. A patient is coming to us having some type of joint pains with some exposure to cold, wet weather, and restlessness is there. Only seeing the symptoms, we can prescribe Restox to that patient. There is no need for going more deep. But when the patient comes to its level 2, we need some pathology counterpart. Why? Because two remedies may have similar symptoms, but their sphere of action or effect of action can be changed. So differentiator becomes the basic pathology. So it will help us to make the prescription more standardized. And the level 3, when it comes, it is a place where homeopathy remedy starts to act. We all know about Master Hahnemann. He found out this theory of chronic diseases or miasms when he followed this theory when at the 1814, when he found that the chronic diseases cannot be cured by giving the medicines which are just symptoms. Because he was treating many number of patients, n number of patients, using homeopathic principle he made by himself, but the chronic diseases was not getting cured. It is getting recurred again and again. For that purpose, he introduced a concept called miasm, and that miasmatic influences can be seen from level 3. So from level 3 onwards, homeopathy's scope is pretty high. Up to level 3, the scope of homeopathy is equal to allopathy or any system. Because in level 2 management and level 1 management, if the patient goes to any physician, he can get a cure or he can get suppressed. If he gets suppressed, he will travel from level 1 to level 6. That will happen. So if he comes in level 3, we have to prescribe an anti-miasmatic medicine. At this point, I just want to make a distinction between the miasm of Dr. Samuel Hahnemann versus the concept we used to do. So, I call the concept we use today as gene ID rather than miasm. Why? Because we call miasm as functional and structural. That concept is not from Master Hahnemann. According to Hahnemann, miasm is just venereal and non-venereal. And if it is venereal, it can either be psychosis or syphilis based upon suppressed gonorrhea or syphilis. It can be, if it is non-venereal, it comes under SORA. So in today's world, we can get maximum number of cases of Hahnemannian SORA. So we have to prescribe an anti-soric medicine. That's rule number 1. Gene ID because it is what we tell as construction, what we tell as destruction. These all are related to the genomics or the genetic profile of each individual. So gene ID means whether it is a construction or a destruction. So in cases where we see the patient has a hypertrophy or warts or kidney stones, it shows that there is a over-constructive tendency. I call them as psychotic gene ID. And destructive things, I call them as syphilitic gene ID. So from H.A. Roberts onwards, whatever concepts that has been developed in homeopathy, I have called all those concepts as gene ID and not miasm because it is very much confusing. So in level 3, you have to prescribe an antisoric medicine and a gene ID similar medicine. It can be either SORA, syphilis or psychosis based upon the genetic manifestation or the symptomatic manifestation of the patient. So from level 3 onwards, the homeopathic paradigm starts. So after level 3 comes the level 4. In level 4, we have to see the symptom similarity, we have to see the pathology, and we have to see the miasm and gene ID. But the most important part is that from level 4 onwards, the case is getting little more complicated so that we have to do prognostic assessment frequently. Because if in a case of fibroid, if in a case of fibroid, if it comes in the level 4, you have to do this ultrasound scanning every 3 or 4 months. But if it comes under level 3, that much frequency is not required. Why? Because the pathology has not yet been established. So from level 4 onwards, every doctor must be extra cautious that this case can go even to surgery level. And then comes the level 5. The level 5, what happens is that the only rescuer is the similibum, what we have told and taught. Only in the level 5, that types of similibum is required. Whichever school we study, whichever method you study, the level 5 is the place where you have to go for the similibum. So some may ask the question, say, if we give similibum from level 1 onwards, will it be okay? I will answer this with one simple example. Suppose if you think your mobile, we all have mobile phones. In that mobile phone, one single app, some called as Facebook. If Facebook is not working properly, is there a need to format that thing? That's my question. If our mobile phone, I want somebody to answer this question, yes or no, in the chat box. By after which only I can continue the session. The question is, if I have a mobile phone and I'm using the phone, the app Facebook is not working properly. So should I uninstall or correct the Facebook, or should I have to format the whole device? What is to be done in such cases? If you have in your phone, if the Facebook is not working, what will you do? Will we format the whole device, or will
No,
we?
no, sir. We wouldn't format. We would uninstall Facebook.
Well, yeah, we will
And we
uninstall
would try.
Facebook and reinstall
Yeah.
Facebook, right?
Yes.
There
Yes.
is, yeah, that's it. That's it. Similarly, in the level 1 cases, there is no need to give a similibum. Similibum is just symptomatic medicine. So similibum changes from level 1 to level 6. So in level 5, we have to give medicine to the patient which has the ability to format his whole body, whole psyche. That is, psychosomatic nature must be formatted. That is why it comes under level 5. I am explaining this point once more. You have seen some physicians treating very difficult cases and getting very good results. But at the same time, some other doctors also has huge number of patients, but he is not taking some type of cases that the doctor one is getting. Doctor one is treating cancer, stroke, glaucoma, like severe cases. Doctor 2 is treating cases like allergic rhinitis, urticaria, bronchitis, etc. Both are having good number of patients. But the level that Doctor A is getting complicated case and he is getting good results. Why? Because he has mastered the level 5. The second type of doctor can also get good results, but there is no need to master level 5. Up to level 4 knowledge is enough for him to get good number of patients. So this is the place where I want to place our homeopathy. Again, I am coming to my point number 1. The problem with homeopathy is not the ignorance of the doctors. All the doctors know Medica. All the doctors are getting so much results. That is the only reason why homeopathy is sustaining even now. We know homeopathy is just 200 years old system. It is not 5,000 or 10,000 years old. Only 200 years old system. After the World War One, the introduction of the antibiotic of penicillin, homeopathy has faced such disaster that it has been removed from many part of the country. Before that, instead of introduction of penicillin, homeopathy was a blooming system. Even now, in almost all parts of the world, even if it is not insured or anything, in almost all part of the world, there is a homeopath. The reason for that is the homeopaths who are practicing till date have put their blood and effort into that system. So now it is our time to do the justice to our system. For that purpose, what we have to do is that we have to standardize the plan of treatment and must not standardize the medicine. If you try to standardize the medicine, that is against the thing called individualization. According to in homeopathy, individualization is the first and foremost characteristics of homeopathy. So without losing its individualization, how to standardize homeopathy? The only way is to standardize the plan of treatment. For that purpose only, we will made this level 1 to level 5. In level 5, we have to format the whole device, or we have to give the exact similarium to that specific case. For that purpose, we can use any methods. We are using a method called method of triangles, which we developed in our own cases. And once this level 5 is get passed, the case moves to level 6, which is called palliation. Here you can see a beautiful lineup that a patient is coming for a allergic rhinitis. If the doctor is giving him steroid spray as the steroid spray for this nasal obstruction or sneezing, if he use this steroid spray, what happens is that it is an immunosuppressor. Automatically, this is an allopathic medicine. So what happens is that this gets suppressed and he gets a bronchitis-like symptom. So from level 1, he slowly moves to level 2. And when becoming level 3, his latent sora is automatically getting activated because of this medicine. He turns to level 3. And when the pathology is increasing, he changes to level 4. And by that time, allopathic medicines cannot do anything because proper anti-miasmatic medicine. I have made clear that anti-miasmatic is Hahnemannian concept. That is anti-soric of Dr. Hahnemann must be prescribed to that patient. Along with that, we have to see the gene ID of the case also. Whether gene ID is psychotic, soric, or syphilitic. I know this full concept may sound confusing, but it is very simple. What I am telling is in the textbook of organ medicine itself, and this is not a new methodology. This is just I am making everything in a single sheet. And so slowly after the simillimum, if any doctor fails to give the simillimum at level 5, the case slowly progresses to level 6, that is palliation. At palliation also, homeopathy can do wonderful. Why? Because homeopathy can increase the quality of life of the individual. So this is the levels of the patient. So when a patient comes before you, we all must be unable to understand which level the patient is. Is he in the level 1 or level 2 or level 3 or level 5 or level 6? But the method I use is that I use this using a questionnaire. Why I made questionnaire is that it is for the easiness of the junior doctors. Because whenever I have seen when I sit my father's clinic, when I was passing out, some patient will come and talk something. He may takes hardly 10 to 15 minutes. He may listen and he will ask the patient somehow 1 or 2 questions. And that questions, actually I got confused. How can he ask that correct question? He will ask the question, what is the issue with your mother-in-law? He may ask the question that, what do you have any extra fare? He directly ask that question to the patient, and almost all cases the answer is yes. So how he was able to reach at that point? That was my thinking process. And after that only I understood that whenever he prescribes the medicine also, it follows an order. For every cases, he is not giving anti-miasmatic. For every cases, he is not bothered about this pathology. Some cases, so there is a difference between prescription for each and every patient. So that difference, I have changed into a tool, and this thing is very useful for the practitioners. And this is, I wrote this tool in 2018, and this tool is already patented and copyrighted under Government of India services. And this has been validated in some of my friends' clinics, nearly 200 to 300 clinics. And for juniors, it is much easy. And those doctors who know this thing without this tool have got most number of results. Other doctors are just suffering. Why? Because in a case where you need anti-miasmatic medicine, he may give other tips or specific medicines. So this is the thing I want to say. So in the place when individualization become essential is that I already explained it. At the level 5, the individualization becomes essential. And this individualization can be either symptom similarity, or it can be symptom similarity along with the pathological prescription, or symptom similarity, pathology, and miasmatic description. So keep in mind, we have to take the whole case and we have to prescribe the medicines accordingly only in the level 5 of the cases. There is no need to format the whole device if one software is incomplete. So this is the thing. And we have to understand one more thing is that we all follow Master Handman. I respect that thing. But he himself has changed organon 6 times in 32 years. From 1810 to 1842, he has rewritten what he had taught. He has changed his concepts. So we homeopaths must be able to change our concepts as the time passes. Whenever I talk to some stalwarts or talk to some doctors, always we are referring to Master Handman. We can refer to Master Handman, but we must be able to accept the change. Why? Because in Master's time, the remedy was selected based upon the symptoms obtained in drug proving. The first from Singona experiment to the last medicine, whichever he has proved, the only criteria he used was observation. But in 2026, we have enough facilities to understand why this symptom occurred to that specific patient. There are many researchers are going in homeopathic fraternity itself to find out why this bryonia is producing this specific symptom, why gelsemium is producing this specific symptom. So I have slightly modulated the theory of law of similars from similia similibus purender, that is, the medicines which can produce similar symptoms can cure similar symptoms too. The medicines which can produce similar physiological alteration can cure physiological alteration. Why? Because in a healthy human being, when you are giving bryonia, this bryonia drug is causing some physiological alternation inside his body, which makes his body to produce the symptomatology of bryonia. At the Hahnemann time, because he found homeopathy in 1796 and he died in 1842. The total time he got was less than 50 years. Now homeopathy is nearly 200 years old. So the observations made by Dr. Boric, Dr. Clark, Dr. Kent, Dr. Jha, there are many stalwarts till date. So I can tell that we are in a position highly developed than Dr. Master Hahnemann, who had only a raw data of proven remedies. So now we have to see it in a different perspective. I have seen many doctors even now using the old methods of cupping, like methods for the patients in the clinic, which is actually de-promoting our community. We must not do like that. Because we have got a system where the principles are very clear. And today, we can even see the blood picture of the patient and can prescribe the remedies. Why? Because seeing a case of pneumonia, if we know that is a case of pneumonia, day 2, if we prescribe correct homeopathic medicines, the pneumonia can be cured in next 3 or 4 days. So what I tell is that for the acute emergency like pneumonia, in some cases of gallstones where the CRP level has climbed to 100 plus, with lipase and other thing climbed up to 2000 and SGOT SPPT to 4000 also, where it is said surgery is also needed. Our homeopathic medicines has done wonders at that cases. Within 24 hours, this 124 CRP has come down to 11. Why? This is all because we must be. I looked for only one symptom. The stone is not in the gallbladder. It went in cystic duct. It is obstructed in the cystic duct and it is causing pus formation at cystic duct. And this pus formation is causing there's a complication of rupturing of the duct and it can also cause acute abdomen. For that purpose, we have our homeopathic remedy for that. And prescription of that remedy, what it does was it is doing a marvelous job. Within 1 day, this stone has been expelled from that place and the case has come back to cure. Even the allopathic doctors can't believe our medicines can do that thing. Why? Because That is where I change that thing, because if we go behind symptomatology, there is a chance that we may get wrong. So we must keep in mind the symptomatology, and we must also have the knowledge to understand why this symptomatology occurs when you give that specific remedy. So I want to reframe all homeopathics to, if the patient has a severe headache at the frontal region, brain seems to explode and looking down is causing aggravation, the remedy is bryonia. I want you to study why this symptom occurred to bryonia. Without studying these things in detail, it will be difficult for homeopaths to practice in future, because we can prescribe basic symptomatology, consumations, etc. But in 2026, with the help of AI and other things, all the medical systems are growing in a very huge pace. At that same time, we must be able to catch up with them, not for competition, but for humanity. Because we know that whenever a new treatment methodology is introduced in allopathy, like you can see in case of cataract, there was a surgery for cataract, which was very successful. But now we can see after surgery of cataract, glaucoma started. After surgery, this glaucoma. So only thus we can see the after effects or the side effects of the allopathic treatment only after 15 years from the implementation of a new technology. Now we have see the IVF kits. IVF kits has a lots of issue, right? So whenever we see a new methodology in allopathy, it is causing some sort of troubles in later time. Only through homeopathic system we can cure that purpose. For that purpose, all homeopaths must understand why this remedy is producing this specific symptom. So for that purpose, I have just introduced a drug called gelsemium here. What is the physiological pattern of gelsemium? If we can study gelsemium using this physiological pattern, there is no need to study full veterinary medical. Just this simple physiological pattern. What is the property of gelsemium that is making this drug so much symptomatic? And the thread which we use, that's a book by my father, Physiological Keynotes of the Medicine. And in that book, he has written gelsemium. I will just share that screen to you right now. I'll share the screen of that material medical right now. The book is in the last phase of publishing. You can see gelsemium semipervensis. The thread is that motor paralysis from anticipatory fear. The nervous system anticipates threat and responds by removing the capacity to act, trembling, drooping eyelids, muscle incoordination, and diarrhea before any performance. So if you understand this thing, that is motor paralysis from anticipatory fear, we can apply this gelsemium into lots of cases. Instead of studying one symptom after another symptom, just study this. If we know this common thread. Okay, so the gelsemium is a medicine which has a tendency to produce motor paralysis, not sensory paralysis, motor paralysis, and the exciting cause is the anticipatory fear. Anticipation with motor paralysis, we can think about gelsemium. Likewise, we go to side again. Likewise, this anticipatory fear, you can see all these symptoms of the gelsemium. So every drug, each and every drug has this type of physiological patterns. As a homeopathic doctor, we must be able to understand that physiological pattern. Based upon his guidance, I have completed the nearly 160, 170 drugs, and this book is ready for publishing. It will take another 1 month to come check reviews, checking spelling mistakes, etc. Coming to the publishing after that. In that book, we mainly concentrate on this, how we can study the drug. Similarly, when a patient is coming to us, we have to understand what is inside him that is to be cured. If he is having 10 different symptoms, we have to connect the 10 different symptoms into one and find out what is to be treated in the patient instead of seeing each as different one. And one more point I want to make here clear is that we all are giving mental symptoms high value than physical symptoms. According to us, mental symptoms gets equal value as physical symptoms. Why? Because mental symptoms and physical symptoms are the response of same human body. If we give more importance to mental symptoms than physical symptoms, it can cause some type of imbalance. In cases where it requires importance of symptoms, only in that cases give importance to mental symptoms. Don't take blindly the mental symptoms are the first priority. So I will go with a patient is coming to us. He is very fastidious and he is very perfectionist, but his all the symptoms are showing the of arsenic album mind, and his body symptoms is showing the symptoms of bryonia or gelsemium. He's coming to us for a physical complaint. Which remedy should we select? That is based upon aforesaid number 6. In aforesaid number 6, Hahnemann has clearly mentioned that we must take symptoms only from the point where the disease started. If the patient is coming to you for headache, from the time of headache, only if his nature has changed, then only you take that change in nature. If he is fastidious from day one and he got his headache at the age of 35, you cannot take that fastidiousness. If his nature changed from fastidiousness to frivolousness, you can take frivolous. That's no problem. So it is clear written that we have to take the symptoms which is changed or deviated. So keep in mind these points because these are very minute points, but these minute points has made much importance. So that's why I'm telling you again, when you take a clinical decision, we have to see which level the patient is, level 1 or level 2, 3, 4, 5, 6. In this level where the patient is there, and in that level, what should we do? If we are clear with these two things, then the clinical decision will not be a nightmare for the homeopathy. So we do not need one way of prescribing. We just need one way of thinking before we prescribe. So today I just presented that one way of thinking in a very short manner, not including too much complications. So this is my last slide. And now I will I can answer the question answer right now, if any you have, or I can continue the session if you need.
Sir, we can go for some 10 minutes more because
Okay.
then
Okay.
thereafter we can have a chat.
Sure, no problem. Why? Because this is totally a new concept. That's why I made it so simple. Otherwise, it can cause much chaos inside the minds. The whole concept is based upon aforesaid number 3. How we should understand the patient. Knowledge of the Hahnemann has never told we must see the patient. He has told that what is to be treated in the disease and what is curative in medicine. 2 points. So what is a curative in medicine is similia similibus curandi. What is to be treated in the patient is the one which we have to understand. To understand what is to be treated, there is a method which we use in our clinic called timeline method. The timeline method is just like that. If a patient comes to us for a complaint of bronchial asthma or any complaints, you can take. For the complaint of bronchial asthma is coming. If his age is 45, he's suffering from this bronchial asthma for past 10 years. So we have to go back to 35 years and to find out what happened at the age of 30. And from that time period alone, we have to go through to 45. And we have to give the medicine based upon that symptoms. And once you give that medicines upon that symptoms, this event is closed. Now, if he had any past diseases, before 35 will come back. At that time, we have to take that symptom and clear it. That is called Hering-Stauff cure. That is why when we give a medicine, the last appeared symptom will disappear first and first appeared symptom will disappear last. Why? Because this follows the reverse order only because of the thing is that we have to prescribe the remedy based upon the last manifested symptom. If the patient is coming to us for a diabetes mellitus, and if we started 10 years before, all the symptoms we take must be from that 10 years. We must not go back to he had a history of head injury at the age of 5. Don't go to age number 5, because if that was this complaint, the presentation will start from that time. So all the case is based upon this timeline, and from the age of 35 onwards, we have to change the cases. So this is the basic concept of this case taking. And why this standardization? Because if the system is not standardized, if one homeopathic doctor prescribed one medicine and the patient died, if the parents went to the court of law, if there is no standardization, no other experts can tell this is a medical negligence. He has to face the court suit. Only by the way of standardization, we can get a legal side favorable. Because I'm telling that I have prescribed an anti-miasmatic medicine for this patient because this patient was on level 3 or level 4. Or this was my inference. Other doctor is telling that doctor gave a wrong remedy. The major problem in homeopathy is that if a junior doctor is coming to us and telling doctor a case of fever is there, I gave him bryonia, the fever has not yet cured. The next reply is the remedy you gave was wrong. You gave this remedy. For me, the bryonia was never a wrong remedy. Bryonia was the right remedy which failed to act in that case. Why bryonia failed to act in that case must be studied. But the homeopathic doctors will tell the bryonia is wrong and tell if you have given sulfur that may get cured earlier. With these type of conversations, we can't make our system to a next level. To take a system to next level, there must be something called standardization. We must be able to justify what other doctors do. And some issues is with the advice of the doctor. Some doctors is giving some sorts of advice which is outside the medical textbook. Sometimes he may be highly spiritual, or he may be highly connected to some other things. He may give some advices that is not logical also. But that also affects homeopathy fraternity. So what I'm telling, make the point here is that standardization is the need of the hour. Is 2026 right now, and in next 20 years, with the evolution of the AI, will be totally different. Last time there was a speech by our honorable Chief Minister of Kerala in a college, where he has told that now the scientists are developing AI-driven devices which will go inside the body, target the cancer cell. Just so there is no surgery required. It will just kill the cancer cell and come out of the body. For the cardiac block, this device will go inside the arteries. You go to the exact block location. It will measure what is the block there. Just dissolve that block and come out. So this is going to happen. This is what is happening in the technological field. But they are not curing the disease. They are just removing the block. They are just removing the cancer cells. But that does not constitute the disease. And in US, etc., already there is something called gene card, as we all know. So if I have that gene card, going to the lab, show my gene card, I can stand in that. Automatically, my stem cells and everything will be injected to me. My whole body getting revitalized again. So the whole world is moving towards technology. Homeopathy is very advanced. We are doing this individualization for past 200 years without much concentration. So now it's time for us to unite, stand, and especially these types of webinars by IFPH is great because this is 2,160 days. That means for past 7 years, every day this is being done, and many patients as well as the doctors are this is a huge platform where juniors, seniors, everybody can study anything, and even the homeopathic patients who love homeopathy can also see this thing and come to homeopathy. So this type of platforms must exist. At the same time, we homeopaths must take a pledge to ourselves. We all know we have to look our family, we have to make our livelihood. That's all okay. But this is our responsibility. If we love homeopathy, if we have Hanuman as our master. Hanuman changed 6 times his organon. We are all supposed to change the things and use the most modern techniques and make homeopathy super. Don't try to find substance in homeopathy. Physics masters will do it. We have to do something in treatment part, majorly, basically on this standardization. That was my closing statement, and thank you for giving this chance. Any Q&A we can take back.
Yes, Dr. Nitish, it's really a very good session. You really take us to the latest technologies and latest the need of implementing um, AI in homeopathy. There were so many sessions here on how one can use AI for homeopathy and also. But as you rightly point out, we need to go into detail, in depth in that way, how homeopathy can be used in these circumstances. But the thing is that most of our students who are studying in homeopathic medical college will be in big trouble if this thing happens. But that's a negative thinking on my part. But there is positive also, because how we can allow them to come back to homeopathy, because the homeopathy is a system of experience. But one need to go, if a patient come to your clinic, you just take the case and find out what are the real causes behind the illness and how or it developed, and what is the present situation and what will be the future situation. That means what is the prognosis and what even though we have a diagnosis, patients, most of the patients come with the diagnosis, but diagnosis is just only a beginning for a homeopath. We will have to identify the patient as an individual and find out what is wrong with him, or whether it is physical or mental or both. Forward. But if a patient is giving all those symptoms to the AI and asking what can be the medicine, they may suggest that it may be a case of Staphylococcus aureus or Natramur or sometimes Ignitia. And in those conditions, the physician's knowledge in materia medica will be the uh, point to be there to choose the right medicine. But even after choosing the right medicine, if a junior doctor gives a particular medicine and it is not acting, all of a sudden he will wonder, wow, I have chosen the right remedy or medicine, but still it is not working. What step I have to do next? So many questions to be answered in that way. Then if he or she just click on the chat box AI and asking what shall I move forward, then he used to say that you can go to the next potency or something like that. But we know that we need to wait for some 7 days or 10 days or some 20 days for the action of that particular medicine. Even in an advanced pathological case, we cannot do that like that. But the most important point, after giving the medicine, what kind of general improvement happened in the patient? That is if, for example, a patient is lying for a long time in the bed, and after you just give a dose of like a podium or gelsemium or opium for the patient at the time of your consultation, and when you visit for the second time, he started sitting in the bed. So that is the first sign of improvement. Then, even though the other things are not getting improved, you can You can analyze this as a case of improvement. But these are the things to be feed into the so-called artificial intelligence. Then only he will say, or the AI will say, "You just wait, man. You just wait, man. You will get the result soon." Like that. Am I right?
Yeah, doctor. Yeah, yeah, that's right. But the issue here is that The problem is mostly the explanation of the case. Sometimes if the case get cured also, patient comes and, doctor, my disease got cured. How this disease got cured? What will we give the explanation? We will tell that my medicine works on your vital force and that vital force got stimulated and you got relieved. We can't give that type of explanation in 2026. That's a basic problem. For that purpose, that's the point which I came back. But exactly the juniors are confused with when to start treatment and when to stop treatment. They don't know about these things because they are totally new to this thing. That is why I created this tool. I will, in this next class of my father, Wednesday class, I will demonstrate the tool and show how the scoring goes. But I want to tell you one point here, sir. The explanation given by homeopaths to the patient, why your disease got cured, is even now it is highly philosophical, more than scientific backed. That's the point. That's the point I made, that if I gave one medicine, it got cured. Why? It doesn't got cured. Why? For that why, we are answering using philosophy, and that philosophical answers we can give inside the fraternity of homeopathy, but outside the fraternity of homeopathy, it is not possible. For that purpose, actually, the book that there are 5 books my father has, we have written right now. One is the Principles of Homeopathy, where he has discussed about chronic diseases, miasms, everything in the modern perspective. Second is about the practice of medicine. Today we are using the allopathic practice of medicine book and practicing homeopathy, which is not at all possible. This practice of medicine book will be in such a way that if you are dealing with hypertension, if a patient is coming before you for hypertension, how to individualize hypertension based upon the patient and how to select the remedy. Likewise, we will be moving, and that all things he will be explaining in the classes which is coming in the next sessions. The basic thing is that I have given you the medicine based upon this logic. One logic must be there, and that logic must be acceptable. Otherwise, this will become just a philosophical narration, and that is what homeopathy is facing right now. But
Yes.
think of just one thing, last statement. Hahnemann published homeopathy in Hufeland's Journal 1796. It is the journal equal to Lancet. After that, no homeopath, including any of our pioneers, failed to publish in an article in Lancet. Since we cannot publish any article in Lancet, we are just a failure. You can see one more thing. Whenever you see Hahnemann's book, you can see footnotes, references, appendix. No other authors have reference, footnotes, appendix. They have their ideology alone. That is the difference between a scientific person and a philosophical person. Homeopathy was scientific by Hahnemann, made philosophical by pioneers. So that is the basic difference. And he has given his explanation, even which is valid right now.
That means that you people having 5 books with you, and you will have to feed all these books into the AI. Otherwise, AI will not be able to choose this kind of thing during
Today, actually, say without
otherwise,
AI also we can do it using algorithm. I will show you. I have made an app using algorithm where you have to answer the questions. There will be Q&A session with you and the app. It is not AI, it's algorithm. And once you answer that full questions, the remedy will come automatically. This is based upon method of trial. I have the app is ready with me. It's a testing phase going through. I will demonstrate everything in these sessions. So many homeopaths will let me know what all advancements are happening in homeopathy at different areas. In Kerala, we are doing. Sometimes UP, somebody other may be doing. So we will make this platform as a junction where all the advancements, what is coming in homeopathy, come as a common part.
yes, I think Dr. Radhakrishnan sir is there.
Yeah, he's there.
Yes, sir. Please.
Hello, yes.
Please make your statement here, sir.
Okay, here what he said, the last class I already told here, that such and the hidden protocol and the methods of triangle. What he described is hidden protocol, because whatever be the case comes to us, we must understand the status of the disease. That's the first motto of us. Only after understanding by getting the diagnosis, then we can proceed. Therefore, we are just insisting upon the hidden protocol is a tool which is meant to understand or to just to make a status over the disease. Only after getting, that is according to the HP score, hidden protocol score, what number we are getting. According to it, we are categorizing the patients into 6 levels from 1, 2, 3, 4, 5, 6. That's why we have to understand in which level what score is in level 1 and what score is in 2 and 3, etc. till 6. Then whenever if the case of the level 1 comes, it is only a symptomatology is only to be considered. Whereas in the second level, symptomatology plus pathology. That is simple. Then the third level, the symptomatology, pathology plus myasm and temperament. And the fourth level, these all symptoms, in addition to it, the lab investigations as well as even the surgery may be needed. But in the fifth level, definitely we have to go through all these things along with the absolute simillimum. What happens, I think, the most mistakes that which are occurring in us is each and every doctor knows that we want to get a simillimum. Even a simple cold comes, they are searching for simillimum. No need of it. In the level 1, 2, 3, there is no such condition. Therefore, by using this hidden protocol, we can just understand in which level he stands and what type of method to be adapted. That is, we are making a plan of treatment. Therefore, these are only the things that especially I am considering only from the 4th, 5th, 6th level. The other 3 levels I am already cancelled because most of the physicians of us are using these types of procedure.
Okay,
That's
sir.
why I am not mentioning. Clear? That's
Okay.
why the thing. Therefore, hidden protocol verification is a must, and definitely the doctor will get a confidence. We are doing in such and such situation. We are already adapted. What pathology comes there? What type of lab investigation is needed? And how can differentiate?
Okay, sir.
Therefore, okay, time I have
Uh,
time.
yes, sir.
Please, thank-
Sir.
okay.
Yes, sir. If Dr. Nidheesh is available, we can do the second part on coming 31st.
Okay, we can 31st. Let us discuss. Okay, let us
Yes.
31st. Okay, that
Okay,
is
sir.
the 31st. Then you can ask to Nidish. Nidish, are you engaged for this 31st?
Okay, sir.
31st എന്താഴ്ച വരുന്നത് sir?
What week?
Okay, we can do in that way.
Ah, yeah.
Okay.
Okay. Okay, anyway, we are continuing. We want to continue. That is in the English as well as in the Malayalam. Only
Okay.
because I am taking the class in the Malayalam session. After that, I will take the same session in the English also.
Okay,
I
sir.
shall try my best to you. Okay.
Okay, sir. Thank you. Now I'm inviting Dr. Arya to say, Miss Arya to say a conclusion remarks.
Yes, sir, am I audible?
Yes, yes.
Thank you so much, sir, for that highly informative and thought-provoking session on a structured approach to clinical reasoning in homeopathy. Your insights have given us a valuable perspective on the importance of structured thinking, observation, analysis, and clarity in clinical practice. We would also like to thank you for sharing your experiences, your valuable experiences, and for introducing us to the fascinating concepts behind your work. And on behalf of the International Forum for Promoting Homeopathy, I express our sincere gratitude to Dr. P NIDHEESH for taking the time to be with us and share his knowledge and experience. I would also like to sincerely thank all the participants who have joined us today and contributed to the success of the webinar with their presence and active participation. For those who wish to explore more about the activities of the International Forum for Promoting Homeopathy, our previous webinar recordings are always available on the IFPH YouTube channel. We request you to subscribe to the channel as well as continue supporting the uninterrupted daily activities of IFPH. With this, I conclude today's session. Thank you.
Thank you, Ms. Arya, Dr. Nidheesh, and Dr. Radhakrishnan sir, and those who attend the English session. And tomorrow we will have a session from Dr. Mridut Mahani, and he is the professor and HOD, Department of Physiology and Biochemistry from Kamadar, Homeopathic Medical College, Rajkot, and we'll be talking about from hepatocytes to healing, integrating liver physiology with the homeopathic therapeutics. Thank you, Dr. All. Thank you all. Good night. It's the time for Malayalam session. I am inviting Dr. Maria Majon to moderate the session.